Hey, it's Matt. Steroid injections can give you quick relief for your low back pain, but is it really a long term fix? Here's the truth that nobody tells you about. Steroid injections reduce inflammation around the nerve roots and the joints, and this can give you some quick relief from your pain. That's valuable during a flare up, especially if pain is limiting your movement, but they don't correct the underlying causes like poor movement patterns, muscle imbalances, or joint stiffness that caused the irritation in the first place. Here's where a lot of people go wrong. They get an injection, feel a little bit better, and then do nothing else. They sit back and hope the relief lasts or just keeps improving. Here's the problem with that: that short period of relief is your window of opportunity. With pain temporarily dialed down, you can move more freely, walk farther, restore mobility, start rebuilding core control. Skip it, and the same stressors that caused the flare up are still there. So the pain cycle almost always returns. By the way, if you want a good starting point, check out my free mini course in the show notes. Study after study shows that injections alone rarely provide long term relief, and the pain usually returns within weeks. But when you combine that short term pain reduction with structured movement based rehab, that's when outcomes improve dramatically. Better function, fewer flare ups, and more confidence in daily life. It's not just about the needle, it's about how you use that window it gives you to retrain your body and change the way you move. Steroid injections are not meant to be a monthly routine. Research shows that repeated use, especially in older adults, can weaken tendons, thin cartilage, and is linked to higher risk of fracture. One large study even found that a 21% increase of fracture occurs for each additional injection a year among adults over the age of 50. The real opportunity is in the relief window. This is when pain is low enough that you can work on things that are the root cause of your pain. Patients who start rehab in this window often regain stability faster and report fewer flare ups, reducing the chances you'll need injection number two or three or surgery. If you're not sure where to start, I put together a free guide with 4 back saving techniques you can use right now. You'll find a link in the description in the show notes. So, some of the things you can work on are improving your hip mobility or your spine mobility, building up your core control and endurance, improving your lifting technique, progressing your walking program, working on your posture, fixing the root issues, not just the symptoms. Injections are not the enemy. They can be a useful first step, but only if you treat them as the starting line, not the finish line. Use that pain relief window to make permanent changes. That's how you turn short term relief into lasting progress and avoid getting stuck in that cycle of repeated injections or unnecessary surgery. Thanks for watching today. Give me a thumbs up if you enjoyed this video. Check out my channel for more free helpful advice, and I appreciate you stopping by.